Hey everyone, welcome back to Dr. Tripathi YouTube channel.
Bringing a new life into the world is a momentous occasion, filled with anticipation and excitement. As expectant parents, you are embarking on an incredible journey with many important decisions. Choosing between a cesarean section or a vaginal delivery is one of them. Both options are valid and safe, each with its own advantages. This essay provides clear information to help you make an informed choice. Remember, there is no right or wrong way to give birth. The most important thing is that both you and your baby are healthy. This journey is uniquely yours, and the decision rests in your hands. Open communication with your healthcare provider is key. Ultimately, the goal is a safe and positive birth experience. Embrace the journey, trust your instincts, and remember, you are not alone. Let's delve into the world of C-sections and vaginal deliveries. Before we dive into the pros and cons of each delivery method, let's first establish a clear understanding of what each procedure entails. Don't worry, we'll keep it simple and straightforward. A C-section, or cesarean section, is a surgical procedure where an incision is made in the abdomen and uterus to deliver the baby. It's typically performed under regional anesthesia, meaning you'll be awake but numb from the waist down. C-sections are often planned in advance due to medical reasons but can also happen unexpectedly during labor if complications arise. Vaginal delivery, as the name suggests, is the process of giving birth through the vagina. This is the most natural way to deliver a baby and often involves labor, a series of contractions that help your cervix dilate and thin out to allow the baby to pass through the birth canal. Both C-sections and vaginal deliveries have their own unique processes, and understanding these differences is crucial when making an informed decision. Remember, your healthcare provider is your best resource for answering any specific questions you may have about either procedure. Now that we've clarified what each delivery method involves, let's explore why someone might need or choose a C-section or a vaginal delivery. C-sections are often recommended for health risks to the mother or baby. Common reasons include breech position, placenta previa, and multiple pregnancies. Vaginal delivery is often chosen for its natural process and benefits like shorter recovery time. It also promotes bonding and breastfeeding through hormonal benefits. The decision is personal with no right or wrong answer. Just like any medical procedure, both C-sections and vaginal deliveries come with their own set of potential benefits and challenges. Understanding these can help you weigh your options more comprehensively. Let's start with C-sections. While they are generally safe, they are still major surgery and come with risks such as infection, heavier bleeding, longer recovery time, and risks for future pregnancies. However, C-sections offer certain advantages, including planned delivery, lower risk of urinary incontinence, and control in certain situations. Now, let's consider vaginal deliveries. While generally considered the lower risk option, they can present challenges like painful labor, tearing, longer labor, and potential for interventions. However, vaginal deliveries also offer numerous benefits: quicker recovery, lower risk of infection, and benefits for the baby, such as helping clear the baby's lungs and exposure to beneficial bacteria. It's crucial to discuss these benefits and challenges in detail with your healthcare provider. They can assess your individual circumstances and help you understand which factors are most relevant to your situation. Section 5. The Road to Recovery: What to Expect. Understanding the recovery process for both C-sections and vaginal deliveries is essential for preparing yourself physically and emotionally for the postpartum period. C-section recovery is more involved as it involves healing from major surgery. You can expect to stay in the hospital for 2 to 4 days, during which you'll receive pain medication and assistance with caring for yourself and your baby. Once home, you'll need to take it easy for several weeks, gradually increasing your activity level. Lifting heavy objects, strenuous activities, and sexual intercourse are typically restricted for 4 to 6 weeks. You'll also need to keep the incision site clean and dry to prevent infection. Vaginal delivery recovery, while generally faster, still requires rest and careful self-care. You'll likely stay in the hospital for 1 to 2 days after delivery. You may experience vaginal soreness, bleeding, and discomfort, especially if you had an episiotomy or tearing. Pain relief options are available, and your healthcare provider will advise you on how to care for your perineal area. You'll need to avoid strenuous activity for a few weeks and gradually increase your activity level as your body heals. Regardless of how you deliver, it's essential to prioritize rest, eat nutritious food, stay hydrated, and allow your body time to heal. Don't hesitate to ask for help from your partner, family, or friends during this time. Section 6. Debunking the myths, separating fact from fiction. Unfortunately, many myths and misconceptions surround C-sections and vaginal deliveries. Let's debunk some of the most common ones. Myth 1. Once a C-section, always a C-section. Fact. While having one C-section does increase the chance of needing another in subsequent pregnancies, it's not always the case. Many women successfully have vaginal births after C-sections, known as VBAC. Myth 2. C-sections are the easy way out. Fact. C-sections are major surgery and come with their own set of risks and challenges. Recovery is longer and more involved, and it's simply untrue to say it's the easy option. Myth 3. Vaginal deliveries always result in tearing. Fact. While tearing can happen, not all women experience it. Perineal massage during pregnancy and proper pushing techniques during labor can help minimize the risk. Myth 4. You can't have pain relief with a vaginal delivery. Fact. Numerous pain relief options are available during labor, including epidurals, nitrous oxide, and other medications. Your comfort and well-being are paramount. It's crucial to rely on credible sources of information, such as your healthcare provider, reputable medical websites, and evidence-based books, to separate fact from fiction when it comes to childbirth. Section 7. C-section delivery, focusing on maternal health. While this essay aims to provide a balanced view of C-section and vaginal deliveries, it's crucial to highlight that in some cases, a C-section might be the safest option, particularly when considering maternal health factors. Certain medical conditions like preeclampsia, gestational diabetes, or heart conditions can pose significant risks during vaginal delivery. In these instances, a planned C-section allows for controlled delivery, minimizing potential complications for both the mother and the baby. Furthermore, if a woman has undergone previous uterine surgery, such as a previous C-section or fibroid removal, a C-section might be recommended to avoid the risk of uterine rupture during labor. This proactive approach prioritizes the mother's safety and well-being, ensuring a positive birth experience. It's important to remember that every pregnancy is unique, and medical recommendations are tailored to individual circumstances. Open and honest communication with your healthcare provider is paramount to make informed decisions that prioritize both your health and the well-being of your baby. Section 8. Vaginal delivery, embracing the natural process. Vaginal delivery, often referred to as natural childbirth, is a testament to the incredible capabilities of the female body. This natural process, which has been happening for centuries, involves a complex interplay of hormones and physiological changes, culminating in the miraculous arrival of a new life. While labor can be intense and demanding, it's also an empowering and transformative experience for many women. The release of endorphins, natural pain relievers, helps manage discomfort, and the feeling of accomplishment after delivering vaginally can be profoundly moving. Moreover, vaginal delivery offers numerous benefits for the baby, including exposure to beneficial bacteria as they pass through the birth canal, which is thought to strengthen their immune system. The contractions during labor also help to clear fluid from the baby's lungs, preparing them for breathing outside the womb. Choosing a vaginal delivery is a personal decision that reflects a woman's trust in her body's innate ability to birth. It's a journey of strength, resilience, and ultimately, the joy of bringing new life into the world in the most natural way possible. Section 9. Your birth journey, a personal and empowering experience. As we conclude our exploration of C-sections and vaginal deliveries, it's essential to reiterate that there is no right or wrong way to give birth. Each birth story is unique, a tapestry woven with individual experiences, preferences, and sometimes unexpected turns. The decision of how to welcome your baby into the world is deeply personal, one that should be made with careful consideration, informed guidance from your healthcare provider, and ultimately, trust in your own instincts. Whether you choose a C-section or a vaginal delivery, remember that you are strong, capable, and deserving of a positive and empowering birth experience. Celebrate the incredible journey your body is undertaking and embrace the miracle of bringing new life into the world, however that may look for you. As you embark on this extraordinary chapter, remember that you are not alone. Surround yourself with a supportive network of loved ones, communicate openly with your healthcare provider, and trust in your ability to make the best decisions for you and your baby. Welcome to parenthood, a journey filled with love, laughter, and unforgettable moments.